Good morning or good afternoon, everyone. Welcome to today's webinar about Pain CPN. We ask that you mute your microphones. There will be a question and answer session at the end of today's webinar, so if you have a question, you can use the chat feature to submit it to Dr. Iorio. A recorded version of this webinar will be available later on the Chronic Pain Network's YouTube channel. I'd like to welcome today's presenter, Dr. Alfonso Iorio. Dr. Iorio is a professor in the Department of Health Research Methods, Evidence, and Impact at McMaster University. He is the director of the Health Information Research Unit, which is a research unit that conducts research in the field of health information science. He is also the director of the Hamilton-Niagara Regional Hemophilia Treatment Center, located in the McMaster Children's Hospital. He also has clinical on-call privileges at the Juravinsky and McMaster Thrombosis Clinics. Dr. Iorio also is a principal applicant for the Chronic Pain Network, as well as the co-chair of the network's Knowledge Translation Committee. So welcome, Dr. Iorio. We look forward to learning more about Pain CPN.
Thank you. Welcome, everyone. Good afternoon. I'm very happy to be able to introduce you to the new functionalities we have created for Pain Plus in the Chronic Pain Network version that we have developed over the last year, particularly because we need from now on a lot of input from users or collaborators to make it as we need. The learning objectives for this webinar are on the slide you are hopefully seeing. We will cover what the Plus service is. Plus is a premium literature surveillance service, is a refinery of research results poised to select high quality, ready for clinical use research results in all fields of medicine. Pain CPN is built on the Plus engine, and it selects what is relevant for the chronic pain community. And Pain Plus has a very specific and new feature that is not available for other disciplines, where we create translation of research results into a lay language, a lay format, hoping to reach farther than the pure core research community. So we will cover some details of these three aspects, and we'll learn a few specific tasks that you can perform on the Pain Plus website, mostly function aimed to help us selecting content for writing the evidence summaries. And I will give you more detail later on, of course, and not only helping us selecting which one to write, but also helping us verifying if we write them properly and giving us as much advice as possible into what works and what doesn't. Writing lay summaries for non-professionals is a difficult task about which there are things we know, but many more that we need to learn. And hopefully, if I'm successful in covering this topic, you will decide to become a jury member. You will decide to sign up to help us in the task I'm going to describe. What is the Plus process in a nutshell? This slide comes from our website, and I'll invite those of you who want to know more about this process to visit the Health Information Unit Research website. I'll show you the address later on. But in a nutshell, what we do, we read about 150 journals. And just to give you an idea, there are about 20 journals that cover specifically the pain and the chronic pain domain, plus high quality research results may be published on any clinical journal and will be captured by this initial screening. There is a manual review of the articles that are potentially good articles for dissemination. We check them for quality. we make sure that they follow the highest standard for research. We give them index about are these relevant for pain doctors, are these relevant for physiotherapists, are these relevant for general practitioner, are these about back pain or different kind of chronic pain or headache and so on. After this internal work is done, after we have assessed the quality and we have decided or tentatively decided who can be interested in receiving that article, we send this article out to a network of about 5,000 co-workers we have around the world, which are practicing professionals in the specific domain. So if it's about pediatrics, it goes to 5 pediatricians. If it's about instead emergency medicine or emergency treatment, it goes to ER doctors or ER nurses and so on. And we ask them 2 questions. One is this piece of research clinically useful? And we ask them to give a score 0 to 7. Is this piece of research new? Did you know already about what this paper describes? And again, we ask them to rate them 1 to 7. Only those articles who are declared to be at least 4 out of 7 for both relevance when the practitioner plan to use them in a significant number of their patients, of course, requiring that specific intervention. When they score about 4 for both relevance, they are useful, and newsworthiness is not something that everyone knows. Then we select those articles that are high quality, and now we know from judgment of practicing health professional that they are also relevant and new. We put them into plus, and then from plus, they are used to feed many different scopes. They are used to update online textbook of medicine. They are used for feeding the healthcare system of Norway, Finland, and so on. I could spend 1 hour telling you how many things are done out of plus. But what is relevant for us today is that if they are about chronic pain, they are passed on to the Pain Plus Chronic Pain Network website, which is what is the main objective of our goal today. Why I spent a few minutes to tell you about the plus process? Because I will show you that we need patients and we need non-specialists to give us advice about what to do with some of these articles. We don't need you to judge about their quality. We don't need you to judge about their relevance or their newsworthiness. This has been done already. If the article gets to you, when the article gets to Pain Plus, has already surpassed all these steps. And just to give you an idea, we cover about 70,000 research articles per year, and we pass on only about 3,000 to 4,000. The ones that get to Pain Plus in 1 year are in the order of few hundreds. So very selected research result. This is Pain Plus, and I hope that you have already registered for this website. It's free. You can go to the website. Let's see if I can go directly on the live website, leaving the slides there. This is the website, and there is a registration page. If you are logged out, you'll enter your credential or you'll create your own user, after which you'll get to this page. And from here, you can add your own dashboard where you'll see the articles you have received. You can see or search depending what you may be interested in, and you have a list of evidence summaries. My main scope today is not guiding you on to what you can do on Pain Plus, but is to guide you on helping us selecting the evidence summaries that we will then show in this portion of the website. To do so, you have to sign up to be a JARI member. Once you have registered, you have your user profile. You can go in your profile, account, update profile, and you'll see a section down here. It asks you initially who you are, your email address, asks you to specify if you are a physician, a nurse, a physiotherapist, an occupational therapist, or just a patient, a caregiver, a lay user, or you can decide to say, I'm something else that you didn't capture here, and you put down here what you want as your specification. Where are you from, and so on. This section here tells you, are you willing to become a JARI member? Will you help us selecting content for writing evidence summaries? And if you say yes, down here, you will receive specific requests to rate candidates for evidence summaries. As a regular user, you will receive alerts any time an article is added to Pain Plus, and you will just get a link to go and check that article. If you also select to be a JARI member, you will receive specific email asking you to go in and rate high impact, high chance of being relevant to patient, policymaker, or doctor's article. Again, we don't presume to know everything. We can internally assess the quality. We ask our collaborators abroad to tell us if that's new and clinically relevant, but we don't know what can be relevant to a patient or what can be good to tell your family doctor. We can guess, and that's why we send you some. We don't send you any article we select into Plus. But even for those we think might be good candidates, we need your advice. What happens if you say yes? After you say yes, you will start receiving emails like this one. I'll show you 3 that I left unanswered in my mailbox. So the email looks like this. I come from Pain Plus McMaster HKR, and it says, Dear Alfonso, today we have added 1 new evidence summary candidate in the new in the Pain CPN system. Click here, go and tell us what you think about it. If I click here, I go directly to the Pain Plus site, and I told you I had 3. Here you see the 3 that are left to rate. Let's see the first one, music-induced analgesia in chronic pain condition, a systematic review and meta-analysis. If I click here, I go to this page where I have questions I will be required to answer, and I can see the abstract or the full article. Now, you may tell me, well, I'm not a doctor, I'm not a scientist, I'm not sure if I can understand the abstract. We know that that's not an easy task. On the other hand, we will make that abstract easier to read for patients or for non-specialist doctors, but we need someone to tell us, well, for what I understand, this might be good to know. So from the title, you see that this is about using music to reduce pain in chronic pain condition. And this is a systematic review, is a survey of the existing literature. If I go and see the abstract, a new page open, and I see a standard research report where there is I apologize, it's as small as PubMed shows it. It tells what the background idea is, what was the objective of the study, and what were the results. So if I go to the results, let's see if I can make it bigger. We found that music reduced the self-reported chronic pain and depressive symptoms. We also found that music had a greater effect when the patient chose the music compared to when the researcher chose it. Okay, for what I can understand, it might be something that people like to know. You don't need to worry about the method. You don't need to worry about the study design. This is for sure good research. If not, we'll not be here. So you can focus on the result or the conclusion. The conclusion here in this case says, our analysis suggests that music may be beneficial as an adjuvant for chronic pain patients. I'm not sure if I know what adjuvant means, but still, it says that music reduces self-reported pain and its common comorbidities. Importantly, the analgesic effect of music appears higher when self-chosen over research-chosen music. So if I decide to use music to calm down my pain, I better choose which music I listen to. Okay, let's assume that we know enough and we think, okay, might be good to communicate in a nice, simple way to patients. I'll go back here, and now I have three questions. The first question is, in your opinion, how relevant would an evidence summary of this paper be to the following group of people? Patients with chronic pain. Is this worth telling directly to patients? And you say you have a chance of giving a score from highly relevant to definitely not relevant. Let's say that you say, well, this is probably relevant, and you choose probably relevant. Then it goes on asking you, healthcare professional dealing with chronic pain, do we want to tell this to doctors or nurses, physios treating chronic pain? Well, maybe good for them to know that music can help. So again, probably. The level you rate depends on you. There is no right or wrong choice. We are interested in what our collaborators think about this paper. Policymaker, is this important to make policymaker know? Is there a cost implied in using music? Possibly not. So very likely this is not relevant to policymakers. And then there is a chance of saying, what would be your bottom line message for this evidence summary? And you can write in whatever you think. I might write, music may help reducing some forms of pain. Or you may say, I think this paper is not important in a different case. Whatever you think is good for us to know, you can write in this box. And the final question is, in case we decide to write an evidence summary out of this, would you like to see it before it's published and give us some feedback? And you may say yes, I don't know, or no. If I say yes, when that evidence summary is prepared, I will get it back. When I'm done, I submit my responses, and I've done my job. Now, let me go back for a second to my slide set. On the website, you'll find already articles, and you'll find the article with the scores that were given by physicians. So this is a 5 in 7, 5 in 7 for relevance, 5 in 7 for newsworthiness. You can see the comments that the physician gave at this stage. You can use this button to send these to peers or tweet about them and so on. This is all on the paper as is not what we are planning to build. So what I've just shown in terms of what we request you to do is something that currently is minimally available on the website. There are some evidence summaries. If you go on the website on Pain Plus and you go under evidence summaries, there are about 14. These are just examples that we recommend you go and check just to have an idea of what an evidence summary can be. But that idea is really a starting point. Evidence summaries are something we want to build as part of these chronic pain network project. So these 14 are the starting point. They are very simple, but they might not be the best format for lay people to see. There is a title. We try to make this title in a way that is easy to read and gives already a sense of what that summary says. Yoga reduces pain and disability for up to 1 year in people with low back pain. And if you skip, you see that these sections are already much shorter than they were in the scientific version. There is a result section where we try to say the easiest possible way we can think of what the results were. But this might not be the right format. And really, what we would like to get through participation in selecting which one to write and in commenting on those that are written is to help us finding what's important to put in there. You may tell us, listen, the title, the result, and the bottom line is all what is needed. Don't waste time and space on the background and on the methods and so on. I also want you to consider that we don't think of the evidence summaries as a final product. This is not the end of the process. We hope that by producing evidence summaries that make a short note about a high quality, high relevance, and likely useful for patient and caregivers content in a lay language format, these drops of research will be embedded and included in blogs, will be disseminated through social media, will be used to building patient-oriented material. All of these is the most effective way of doing knowledge translation. We can prepare evidence summary, put them up on the chronic pain website or on Pain Plus, but for sure a tweet campaign or blogs or specific events reach much farther. The idea is to do all the preparatory work to be sure that when we do those campaigns, we include content that has already been distilled and thought of in a way that is ready to be uptaken by lay public. So going over again, using the slide on how you can help us rating papers to become evidence summaries, you will select to be a jury member in your registration page. You receive email, you click on the link, and you'll get to the page where you can rate, or you can read the abstract or the full text. I don't expect you will need many times to read the full text. The full text is available for you. The entire article is available if you want to have a look, but it usually is not needed. The summary, the short resume that is provided at the beginning should be enough. You can access both, and while reading, keep in mind the 3 questions that you will be requested to answer later on. What you are reading is going to be useful to patients with chronic pain, healthcare professional dealing with chronic pain, can be your chronic pain specialist, can be your family doctor, your physiotherapist, and so on. Is this content useful to policymaker? Is this content about a treatment that is not available in our setting? Is this a treatment that everyone knows is effective but is not currently reimbursed for in Canada and patients have to pay for, and so on? And of course, depending what the target is, the evidence summary might be written in a different way. The score that you are requested to give is on a 1 to 7 scale, from highly relevant to definitely not relevant. How you know what is the benchmark? Well, you'll learn with time, and I'll show you in a second that you can see after you are given your vote how others scored that same paper. And over time, you will understand if you tend to be too conservative or too little conservative, but doesn't really matter. The goal is not to give the same score as others do. The goal is to provide the one that will decide which one articles we will use to write evidence summaries, what people think of them. And what is important is your sincere and honest opinion. Then you can provide a message, which can be the message to include in the evidence summary, or can be, well, really, this article is not good And this is the reason why I don't think this is a message that is worth broadcasting. Now, if you don't like going through your email, you can, once you are logged in onto the website, if you click on evidence summaries and you are a jury member, you will see the evidence summaries that are there for you to vote. So if I go back for a second to the website and I'll go to the evidence summaries, let me take another one. Okay, this one here, sorry. You'll see which one are still to be rated. In this case, for this user, there are 6. And you can directly from the website see the one that you are requested to give your opinion on. You can also see the one that you have rated already. And if you go and see and look at the rating here, you will see, the ratings for patient, healthcare professional, and policymaker relevance given by, in this case, 4 different people. And this one said highly relevant, probably, possibly. The one in green is you. So in this case, this person said probably relevant for patient. One other said the same and gave a long comment. This one said highly relevant. The last one said possibly not relevant. Of course, the editor will see all this judgment, will see all the comment, and will decide based on a summary judgment if proceeding to write or not an evidence summary. So if you go to evidence summaries, you see the one you have for you to rate, and you also see down here how others rated the same article you rated yourself. Again, another example, a patient, a doctor, a caregiver. You don't see who did the rating, but the editor will. We'll see not the name, but we'll see the category. And so a patient said that was relevant, a doctor said was relevant, a caregiver said was highly relevant to patient, and same judgment or similar for professional, for policymaker, and comments there. Now, what I wanted to cover has been covered already. I'm happy to go back and clarify any point that was unclear. So among your question or your request, you are very welcome to ask me to go back and make any point clearer. But let me go back for a second to my initial learning objective to make sure we have accomplished them. So Pain Plus is a website selecting high quality research result from the Plus refinery on chronic pain. So high scientific quality, relevant to clinical practice, new and newsworthy on chronic pain. And you can go there and register to receive alerts in a scientific format. There is also a function, there is also space for evidence summaries, which are lay version of the research result report. The format is still to be defined. There are 14 examples there as a starting point. We would welcome a lot suggestion. Add a figure, add a graph, make the result in a table, or make them as short as possible. Give us some background on what that disease is and so on. What can you do to help? You can register to be a jury member. You do that in the profile page of the website. You will receive emails asking you to provide your opinion about that research result being useful to communicate to patients, doctors, or healthcare professional, policymaker. And you can also sign up to check those evidence summaries before they are released. The Pain Plus website has also an editorial platform where the evidence summaries are prepared before they are made available to everyone. Those signing up for, yes, I'd like to see it and provide you feedback, will have a 3 days window where they can provide us feedback to make them as good as we can. So hopefully you will decide to help us with this task, sign up and start giving us your ratings and helping us writing the evidence summaries to populate the chronic pain, the Pain Plus Chronic Pain Network website. So Donna, I'll give back to you. I'm not sure if I will receive questions directly or they will get to you.
Hi, this is Megan. Well, we do have one question. What if a patient wants to rate, but they're not familiar at all with reading research? Is there any tool that you know of that they can go and take a look at to help them out?
There are tools, mostly glossaries that define research terms. So we encountered before adjuvant or systematic review. We can easily link those glossaries or sort of handbook, short handbook to read research for our raters. There is no easy one-size-fits-all method, and we will not be considering writing evidence summaries if this was easy. My personal suggestion would be to try and to learn by doing. You will see that research is very, very repetitive the way it's reported. And if you take the time of reading a few abstracts, you will see that in the end, you can understand the result and the conclusion more and more easily with time. The box where you can provide us comment can also be used to say, I think this is important, this is what I understood, but I'm not sure about this and that. And we will try to come back to you and teaching you with time. If anyone knows or came across specific tools to help lay people to read research, I would be happy to link them. I've seen a few. No one is really completely efficient and easy to understand. You tend to learn a lot that is not directly relevant to what you are going to read. We might cover with a webinar like this the basic of a research standard research report. So if you see, I can show you one here. If you go to one that is to be rated, and then you go on the abstract, these sections are almost always the same: objective, what was the scope of the study, where they took their evidence, and then what they did do, and then the results. Now, when I teach students, I say you read method first, and then you read the result, and then you try to come up with your own idea. This is because we don't know about the quality. But in this case, you know already that someone else looked at this part and felt that this was okay. So I would start by reading the conclusion. And usually the conclusion, even if they have technical terms, so for example, here I see an acronym, ADL. What ADL is? Well, this is something one can teach. When you have an acronym, usually in a scientific paper, you go up at some point, you see the acronym in brackets, and before there is what that means, activity of daily living. They had abbreviated it in ADL, and later on, they only use ADL. So there are some tricks that help reading. I'm not aware there are courses that teach patients how to read scientific research. My experience from a couple of other services is that you learn quite quickly where to focus on, the conclusion. The objective is good to understand what they are trying to do, and so on. I'm not sure if I answered the question, but if anyone has found useful help, we are happy to provide it through the website. I see another question, many questions actually, so let me go back. First one is, I'm wondering how often you need this done, and can we decline a request? Absolutely. So we don't expect you to receive more than one per week, and many people at the same time will receive. For now, if you sign up, you receive all the ones that are proposed. If we get a sufficient number of volunteers, we will then send them to 4 or 5, and then maybe you receive one per month. We have not for now put a function, a button to say decline, but we can easily add it. So I take this comment as a suggestion to add a decline button. And for sure, we would like you to do whatever you can. When an article receives a sufficient number of ratings and the editor decides to proceed writing an evidence summary or ditch the article from the list, it disappears from your list. So if you go to the evidence summary list, you will not see it anymore as an article to rate. So you don't risk to waste your time rating old stuff. When you go there, you see only stuff that is still in need of rating. On average, for now, I think you would receive one per week. Another question says, do you have any thought on how we can increase the reach of the service to patient group and to the larger public? Well, I'll thank you for the question, and my humble answer is I have some ideas, but I don't think I have the most efficient ideas. And I try to make the point, our expertise is in selecting high quality literature, and we are trying to get good at writing the evidence summaries. We have a good reach in terms of people registering to our services and reading what we write, but I would guess that the one of the goals of the CPN network is to use this content when available for broadcasting through existing networks and existing patient organizations. Any suggestion how to make these better and better is welcome. I have another question that's asked, what's your goal for number of reviewers? For each article, we'd like to have at least 3, ideally 5. So if you think that we have about 1, maximum 2 per week, we might be okay with a group of 20 raters, 20 jury members. But of course, if we get more, the more the better. Have you come up with a standard for creating plain language evidence summaries and blogs? We don't have a standard. We have evolved over the last 2 years a progressively simpler format, and we are now working on making that format slightly different for studies about diagnosis. Sometimes the research result speaks about which kind of technique can be used to find the cause of a disease or the specific cause of a pain syndrome in this case. Some other time is what will happen to patient with a specific disease, a study about prognosis, or a study about a treatment. And different pieces of information are needed. We are trying to work out what is important for us to put in these different scopes. But what works better in terms of sequence, in terms of language, we try to write with a grade 12 language. It would be ideal to write grade 8, but for medical content, it's very, very difficult to go down to grade 8. So we don't have a magic recipe for writing evidence summaries. We'd like to get feedback from, again, the jury members or any kind of lay users of the website about what works and what doesn't. Particularly, you are welcome to tell us what's useless, what should not be there, because we tend to, we are professional researchers by training, and we tend to value details that might not be that important for the final users. And we need to hear that that's not important, because we make the method section much shorter than it is here, but still we leave something about how the study was done. You may tell us, well, I don't need to read it as a patient or as a caregiver. You judge if the method was good. Just keep that section. Tell me what the conclusion is and when to use the treatment and where I can get it. That's what needs to be there. Let me see if I covered all the questions that were there.
I think that's everything that's been asked so far. We'll give a few minutes. If anyone else has any additional questions, they should type them in now.
And if someone has problem typing, I think at this point we might even allow someone to talk.
Yes, you're permitted to unmute yourself if you have difficulty typing.
And not necessarily questions. You are welcome to give us comments, and comments doesn't need to be positive. Any kind of criticism, provided it's constructive, will be welcome.
Hi.
Go ahead.
Hi. I just wanted to congratulate you. We've been working on a sort of a similar platform in the area of now of work wellness. And I just wanted to say that I think that where you're going is really, really exciting. And so I just wanted to congratulate you in this invite process. And so that's all.
Thank you. I think
Mark
that
White.
was Mark White. Yeah, thank you, Mark. We also got from Janet the request to send out the link to sign up for I would guess, for Chronic Pain Plus and for becoming a jury member. So, Megan, if you could send to all the participants the link to the website, I can show it on screen.
We'll also make sure we have it available on the CPN website as well as Twitter and Facebook, and then we're going to feature in our Winter 2018 newsletter a piece about Pain Plus. So there'll be all that information there too.
Okay. And anyways, you see it on screen now is www.painpluscpn.ca. I can also type it in the chat.
It's Mary here, and I just want to thank you, Alfonso. I thought it was really, really interesting, and it's such a powerful tool that we can use. And I'm really excited, Megan, by what you just said, because people like Pain BC, and there's so many, like there's big support groups in Quebec for fibromyalgia, for example, and you know, I think we can we can really build momentum using this great tool to, to get the reach out there, and potential is huge. So I think working together, we can really achieve something here. So thanks so much, Alfonso. It was very informative.
Thank you, Mary. And I will never be tired of repeating, this is a scaffold and a platform. We need your help to make these a cutting-edge instrument. We want to populate this list of evidence summaries with something that is written the way information needs to be there. We have now titles, we have this quick section, but we need someone to take the time of guiding us to what is really making these impactful. There's a lot of research in this field, and we are doing our best in trying to find out what has already been learned about what works, what doesn't. It's still a very young research field. There are things we know, there are many more we don't know. So there is also some good chance that we will be able to help the community understanding how to do this job in a professional way. I'm very excited to work with the pain community. I found patient I've been in touch with during this first year of the Chronic Pain Network, very, very willing to interact and very, very thoughtful in their feedback. So I'm happy you see potential. I'm hopeful you'll be helping us improving more and more.
If that is all the questions, I'll give just a minute or so if anyone has any last questions.
It's Janet. For some of the lay volunteers, like for instance, the month of April, I'm taking a course on traveling once, possibly twice, so I know that I'd be a whole month with declining. I hope you don't take offense if it's a longer period of time. Doesn't mean we've lost interest. Just certain periods, where we're busy with our other volunteer activities.
Absolutely not. We want to keep this simple, but for other services in the My Profile page, there is a chance of saying, please don't send me anything in this period because I will be busy or be away. So we could
that's good.
Yeah, we could add a section where we say, please keep me idle or don't send me anything for this period.
I don't mind getting the email and just declining. It's just that there's certain times when, you're piled up with other volunteer things. Like, for instance, I know April I won't have time. I would just, that whole month, decline. As long as that's fine with you. I don't care if there's another box to fill in. As long as you realize that, it's not we've lost interest. It's just at certain times we're either away or busy.
That's absolutely fine. Yeah, decline anytime you need. We won't get offended.
Okay, that concludes today's webinar. Thank you so much, Alfonso. I think everyone learned quite a bit here. And you can stay tuned to the CPN website as well as Facebook and Twitter. We'll make sure we have the link to this webinar available as well as the link to Pain Plus CPN so that if you're interested in becoming a rater, you can sign up. And thank you, everyone, for participating and your great questions.